Hey there. How you feeling? Good, good. So sorry to wake you up. You looked fast asleep. I know it's late, but it's time for your surgery almost. So, I came down here to talk to you about anesthesia and to start administering that for you. So you'll be all ready to go when we wheel you down to the operating room, okay? Okay. Now, I don't believe we've met yet. I'm Dr. Shani. It's a pleasure to meet you. And I'm going to be your anesthesiologist throughout the whole course of your operation. I heard from another nurse that you were having some anxiety about anesthesia and the whole operation. Is that true? Okay. Well, I assure you, there's absolutely nothing to worry about. And I promise I'm going to stick by your side the whole time, from beginning, middle, and by the time you wake up, making sure that everything goes smoothly for you, okay? Okay. Now, I understand that you have some questions for me and some concerns regarding anesthesia. Not to worry, we have some extra time booked off, so I can go over each and every single question with you, okay? And so we can get you all set up. But first, I just need you to verify and answer some quick questions for me, okay? That way we can get started. Sound okay? Alright, thanks so much. So, can you just verify your first and last name for me? Okay. Can you spell the last name? Okay. And for my record, can you just verify your birthday for me? And the year? Okay. Now, this question isn't to alarm you. I assure you nothing's going to happen. However, I do just need to know who your emergency contact is. Just for our record, I promise, okay? It's just something that we have to ask everyone. Okay. Can you spell the first name? Okay. And the phone number? Okay. And what is your relationship to this person? Okay. Don't worry. You're doing a great job. I know it's late, but we'll get you all straightened out and over to the operating room, and by the time you come back, you'll be able to get some sleep, okay? Alright. Thank you for being so understanding and cooperative. Alright. Now, on your chart here in your records, I see this is your first surgery. Is that correct? Okay. Okay. And the location of the surgery. I see. Now, this procedure should take a few hours, but when you're asleep, it's going to seem like a few minutes. You'll go ahead and you'll start to fall into a nice deep sleep, and before you know it, you're going to be waking up in your room, and I'll be right there, okay? Okay. And I believe you have some loved ones coming to your room for when you wake up, correct? Yeah, it should be visiting hours by then, so. Okay. Now, do you have any current or previous medical conditions I should know about? Oh, okay. Are you currently taking any medications for those? Okay. Okay. Now, I know this is your first surgery, but have you had in the past, or have any of your family members ever had a reaction to any form of anesthesia that I should be aware of? No? Okay. We just have to ask to make sure something isn't running in the family, and to make sure there's not something specific I should be avoiding for you, okay? Now, what is your age? Okay. And your height? And your weight? Okay. Alright. All of that looks good. Okay. So, let's go ahead and let's answer your questions before we get started, okay? What kind of questions did you have for me? Okay. There's no reason to be afraid of being put under. I know it can be a scary thought to have someone you're unfamiliar with giving you medicine to make you fall asleep, but I can promise you nothing's going to happen to you on my watch, and you're going to wake up all right. I'm going to be there every step of the way to make sure you're getting the proper dosages, to make sure that you're in a nice sleep, and to make sure you're not feeling any pain, and to make sure you wake up perfect, okay? I know it can still be a little scary. The first time I ever had surgery, I went through a very same feeling, but look, it turned out great, and now I'm an anesthesiologist, so I assure you it's not bad at all. There's even a little trick. I'm going to give you a little bit at the beginning so it kind of flows through your body and it relieves you of your anxiety and calms you. Gives you like a warming sensation and feeling. And that'll kind of ease you and get you used to the medication, okay? And then we'll go ahead and give you some gas. And that's just going to help as well. We're going to do a little bit of an IV drip and a gas. And then from there, while we're going back to the operating room or just before we go, I'll give you the rest of the IV anesthesia, and I'll have you start to count back from 10. and you'll fall into a deep sleep, okay? Don't worry, sweetie, it's not too deep. It's just a saying we say. You're gonna get nice and refreshed, and you'll wake up and it'll all be over, okay? Okay, well, there's 3 different forms of anesthesia, all of which are affecting your nervous system in some way. There's local anesthesia, which is like a drug that's given in like a shot or a spray or like an ointment. And what it does is it numbs that specific area. So have you ever been to the dentist and had to have like a cavity filled? Yeah? Did they ever take a shot and like stick you in your gums? Okay, and you know how it numbed just that one area. Okay, so that's local anesthesia. The other kind is regional anesthesia, and that's a drug injected near a cluster of nerves to numb a larger area. So, like an epidural. So if like a woman's going into labor and they give her an epidural, which is in the spine, what that does is it numbs the waist down. So a regional anesthesia just numbs a portion of the body, okay? You're not going to be getting local or regional. What you're going to be getting today is general anesthesia. And this is kind of like what we talked about. It's great at keeping you asleep during an operation. And we can do it in an IV, a gas, a vapor. And we're going to be doing a little bit of both today. Now, if you were afraid of needles, I might do the gas first and then the IV. But since you're more scared about being put to sleep, I'd like you to be able to experience that. When I went through my surgery, they did the IV for me first and then the gas and then the IV again. And I felt like that really helped because I got to experience it and it got rid of my anxiety. So I'd like to do the same thing for you. You're not afraid of needles, are you? No? Okay, perfect. And what this is going to do is we're going to relieve anxiety. I'm going to help keep you asleep. I'm going to get rid of all the pain of it, or at least minimize it. It's going to relax your muscles. And you're not going to remember anything about the surgery. Maybe getting wheeled into the operating room, but you're going to be able to forget all of that, okay? Feeling a little better so far? Good, I'm glad. Okay. Well, I'm just going to start by listening to your heart and getting your blood pressure. I know you're a little nervous, but I just want to make sure we're at some good levels before I start giving you the anesthesia, okay? Okay, 1 second. I'm just going to set down my clipboard over here. Okay. How you doing so far, sweetie? Good? Okay. Now stop me if at any point you have any questions, okay? I made sure I booked off extra time so we could communicate all of this before you went in, since I heard you had some anxiety about it, okay? Alright. So, I do have to get a little close for this. Is that going to be okay? Okay. I'm going to have you lift up your shirt a little for me. It's a little cold. Okay. And take some nice deep breaths for me. In and out. In and out. You're doing great. Okay, I'm just going to go around back. In and out. In and out. Very good. Okay. Everything sounded really good. I mean, your heart rate did sound a little fast, but to be expected. You're going to feel a lot better in a little bit, I promise. Okay. Next, I just want to go ahead and take your blood pressure. I'm sure you're familiar with the blood pressure cuff. Yeah, I don't love these things either. Frankly, I think they hurt my arm every time I get them done, but they are important, so do you mind rolling up your sleeve for me? Thank you. Oh, that's loud. Hope I didn't wake anybody up. Okay. We're just going to get that nice and snug on your arm here. Okay. Here we go. Okay. Okay. 120/91. That's not that bad. The bottom number's a little lower than I would like, but again, I feel like it's to be expected since you're a little nervous. We can always take it again in a little bit. Okay. Alright. Now, I couldn't find my final gloves. You don't have a latex allergy, do you? No? Okay, good. Because I do have a couple latex gloves here. And I'm just going to put this on to keep things sterile, since we're going to be getting your IV set up and stuff like that, okay? I'm just going to start by grabbing a cotton round here so we can go ahead and sanitize the area that we're going to be putting the IV in. Now, I'm going to go ahead and take my tourniquet right here, and if you could stick out your arm for me. Perfect. I'm just going to tie this a little snug right here, and this is just going to help me to find a good vein that we can put that IV in. Okay? We're just going to wait a second here. It shouldn't be that hard for me to find a vein, though I have terribly small veins, so it always takes nurses forever to find a good vein on me. But I think I'm lucky because I see a very good vein popping up here. Okay. hold still. I'm just going to slide the IV needle in. You're not going to feel a thing, I promise. Though, you said you're not afraid of needles, so here we go. 1, 2, 3. See, didn't hurt at all. Nice job. Okay, so I'm just gonna run this up to the IV bag here. Okay. And we're just going to start with a saline drip. No reason to be worried. We're not going to give you any anesthesia yet. We're just going to start with some normal saline, okay? And turn that on. Like I said earlier, you might just start to feel that saline kind of run through your body, but again, it's nothing to be worried about. It's a normal sensation, okay? Alright, very good. We're just going to wait for that to kind of take effect. And what I'm going to do right now while we're doing that, I'm just going to go ahead and put a piece of tape down on your IV so it doesn't come out. And then we're just going to go ahead and bandage it up just to make sure everything stays in place and sanitary, okay? Okay. Just grabbing a piece of tape here. Okay. And we're just gonna tape it down. Alright. Now I'm just gonna bandage it up. Okay. See, this isn't so bad, is it? You're doing a great job. Any questions for me so far? No? Okay. Well, feel free to stop me at any point if you have any questions, okay? Okay. So. And I'm just going to go ahead and sanitize the area. Now, while we're waiting for that, I'm just going to go ahead and get a needle ready to administer the first round of anesthesia. There's nothing to worry about. This isn't going to be going into your arm anymore. I'm just going to put this into the bag of saline so that way you can start to feel what this anesthesia is going to do, okay? And this is just a sterile needle. So we're just going to open this. Okay. And so this is what it looks like. And I'm just going to go ahead and get the vial of anesthesia. We're going to fill up this little syringe here, and I'm going to put it into your IV bag, okay? Alright, hold on 1 second. I'll let you know as soon as I start putting it into the bag, okay? Oh, shh, 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 shh. There's no reason to be worried, like I said. I'm not putting you under yet. This is just going to help with your anxiety, okay? It's going to feel like a warm sensation. It's going to calm you and run throughout your body. Yep, and you may start to feel like a tingling feeling. And that's all it's going to do right now. Okay? Just to get you used to it. Sound good? Okay. Alright, I'm grabbing the anesthesia right now. Okay. Here we go. 5, 4, 3, 2, 1. Okay. Now, this should only take a couple seconds for you to start to feel it, but it may take a couple minutes for all of it to get into your system. Yeah, are you starting to feel that warm sensation? It kind of starts from your arm and goes up to like your chest and your shoulders, and then your head and face, and then kind of the rest of your torso and then your legs. Okay. And how's your anxiety? Much better. See? Nothing to worry about. The next step here, once that's done, we're going to go ahead and get the gas mask. And I'm just going to place that over your face. I'm going to turn on the gas. And I'm going to have you take a couple deep breaths in and out for probably a minute. Okay? And then we'll turn that off for now. I may have to put it back on you in the operating room, but 1 minute should be fine right now. And then we'll get back to giving you the anesthesia and the IV, because I'll start wheeling you back to the operating room at that point, okay? We'll be all ready to go. Alright. You're gonna be okay, I promise. So, I'm just gonna get that set up. You go ahead and relax and let that just... Alright, I'm gonna get that set up. You just go ahead and relax and let that flow through you. Okay. Okay. 1 second, I'm just gonna connect this. Alright. Okay. Okay. So, here's what it looks like. Not scary at all. And I'm just going to take this, stretch it up over your head. This is going to rest carefully on your face. And I just want you to breathe in and out. Try to maintain steady, deep, slow breaths, okay? Sound okay? Alright. Here we go. Okay. Alright. I'm going to turn on the gas. keep breathing in and out for me. You're fine, I'm right here. I didn't go anywhere. Just focus on your breathing. Keep breathing in and out for the next minute, okay? Okay. Let's just unhook that now. Okay. How you feeling? Good. You should have like a numbing sensation going on right now. Is that how you're feeling? Okay. Well, it is time that I start wheeling you back to the operating room. I think you can handle it right now. I told you it's not that scary. Alright, I'm about to give you your last dose of anesthesia until I see you and the operation's over. So, what I'm going to do is I'm going to take this syringe again and I'm going to put it in your IV bag. And when I tell you to go, I want you to start counting back from 10. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay? And then you're going to be in a deep sleep. To be honest, you probably won't make it past 8. You'll be fast asleep by then. That's what happened to me the first time I got it. Okay? Alright. Here we go. And alright, start counting. 10, 9, 8. Sleep well.